welcome to another episode of the CanEx webinar series. Today we'll be discussing psychedelics and mental health, and we have a very interesting conversation for you today. I will now turn over to our moderator, Mr. Natan Ponieman, who will lead the conversation.
Hey everyone, my name is Natan Ponieman. Okay, so we're here to talk about psychedelics and mental health. The idea of this conversation is that everyone attending will leave with a basic understanding of how psychedelics can be used in a medical and clinical context to improve mental health conditions and also to improve the quality of life from a wellness perspective for a non-clinical population. Let me introduce myself a little bit. I'm a journalist. I'm a staff writer for Benzinga, and I cover psychedelics, cannabis, and the financial aspect of this growing industries. Let's go around the panel a little bit to introduce everyone here. Let's start with Dr. Walcott. Would you like to introduce yourself and tell us a little bit about what you do and your work and your experience?
Thank you very much, Nathan. I'm Dr. Geoffrey Walcott. I'm a psychiatrist. I'm the clinical director of Psychotherapy Associates Limited, which is a private mental health company. I've had a wealth of experience working in both the public and private sector in the clinical aspect of mental health care. And I've also been involved in research activities. Currently, I'm the PI on the research project for a specific psychedelic, which is psilocybin, or popularly known as mushrooms, looking at bioequivalency and a RCT trial to determine efficacy in managing patients with depression. Thank you.
Okay, amazing. Dr. Bhatt, let's move on to you.
Yes, good morning, everyone. My name is Dr. Parag Bhatt. I have my doctorate in pharmacology and physiology. I am the director of science at Silo Wellness and a co-inventor of the first nasal spray that includes psilocybin in it. I have been devoting my time in my research to understanding the neuromodulatory roles of neurotransmitters like serotonin and dopamine as they affect mental health. And that really drew me to this field. I'm really glad to be here with you all discussing this.
Great. And Dr. Gordon, would you like to give us an intro?
Right. I'm Lorenzo Gordon, as you know. I am an internist with experience in diabetology and endocrinology. I am in clinical practice. I am also in education, medical education, in which I am the Vice Dean of the Caribbean School of Medical Sciences. I am consultant to the Cannabis Medicinal Unit at the Ministry of Health, an advisor to the Cannabis Licensing Authority in Jamaica. I'm also on the regulatory committee at the Ministry of Health as it relates to psilocybin and its derivatives. I am in clinical research also in terms of other researches in other areas of medicine, cannabis specifically, and also helping with other clinical framework, both in terms of the Ministry of Health in advising the approval of clinical trials, and also consultant to other groups in the psilocybin space in terms of product development and clinical studies.
Okay, thank you, Dr. Gordon. Well, so a little intro to what we'll be discussing here. Psychedelics, there's evidence that proves that humanity has been using psychedelics for a very long time, maybe even thousands of years. And they have become sort of a bad word in terms of law regulation and from a governmental perspective. And in recent years, there has been a huge rise in the evidence proving that these types of compounds can have greatly beneficial effects for mental health treatment in many conditions that we'll be discussing soon. So the idea is a little bit to understand how these compounds went from being natural compounds that eventually became prohibited by many governments, how they eventually led to search for a better understanding of what these compounds do, and how psychedelics have the potential to revolutionize mental health treatment in the future. Dr. Gordon, you have some slides to show us, am I correct? You have a little presentation that
Yes,
you'd like
yes.
to, yeah.
Yes, just 1 second there to share the slide.
Okay.
Mhm. Can you all see?
Not yet. Okay, so while we wait, maybe we can keep on talking a little bit about what we're talking about when we're speaking about psychedelics. Psilocybin is one of the main compounds that's being discussed right now in mental health treatment. So, well, since we have it up, let's just go on with you, Dr. Gordon, and then we can continue the conversation.
Right. I just want to just do a quick review of the biochemistry of psilocybin, and just to note that, of course, as a chemical compound, is an indole, alkyl amine, and tryptamine, which is the main active ingredient of the group of the magical mushrooms. Psilocybin is a prodrug, and importantly, in the oral form, it is metabolized by first pass liver metabolism. However, in the intravenous form, it is basically converted to psilocin in the kidneys, and that's very important. Importantly to note, the neuropsychological effects of the psilocin appear to be mediated by stimulation or modulation of the certain receptors, and specifically those receptor types are the 5H2A, 5H2C, and 5H1C. Is also noted that also there is inhibition in the gamma receptors that are located. So importantly, the pharmacokinetics aspect of the working is both stimulation and inhibition. Little bit about just a chemical formulation, molar mass and melting point, just an outline as this has been analyzed. It should be noted as we go along, just a quick summary of what I have just said there in a
Dr. Gordon?
form. Yes, please.
Could I interrupt you for a second? I'm afraid that some of our participants are not so well versed in the science. Well, they're not scientists, some of the people participating here, and maybe some of them don't really know what psychedelics are. And this is a very basic introduction. Okay. So would you mind if we first discuss the definition of psychedelics, so what they are, and then we can go into the science?
Okay. Just basically, as I want to just highlight the aspect of this as being a prodrug. Just take it from the simple side, where how does it really act? It's a similar composition to a neuroreceptor in terms of the chemical formulation, it appears to mimic a look of one of these neurotransmitters. Now, the neurotransmitter are those chemical composition or chemical substances which are found in your brain, rest of your body, or it can also be intravenously or taken from outside inside. And they stimulate certain receptors, various cell receptors. These are signaling receptors that will provide chemical changes. The various chemical changes could be in terms of connectivity to a brain, responding to various signaling. Various signaling could be whether it's mood, hunger, and so forth. So something like a chemical composition, such as that which mimic an established substance, which in this case, we said serotonin, will cause these action in your brain. So what we have identified is that this psychedelic mushroom in 1958, which when it was first synthesized and identified by Hoffman, was then used widely. Technically, I simplified my slide to say that between 1950 to 1960, when it was discovered along with LSD, there was at that time a leak in some areas that was considered to be a leak out of the lab, in which the psilocybin got on the market to the public, and persons started to use it mainly for recreational purposes. And just for the regulation's sake here, all of by 1970, when the US was trying to put a whole framework of substances which are called controlled substances together, which include cannabis, psilocybin was put as a Schedule 1. It was then taken to UN, pushed by the Controlled Substances Act, propounded by United States. And for the next 40 years, psilocybin was not given any opportunity for scientists to really continue the studies and investigation of psilocybin as an active substance in treating mental health. I hope that will just kind of simplify in one way the whole beginning of it. So this I just quickly just mention in that summary there, the Controlled Substances Act in 1971 that then really prevent the psilocybin at that time to be able to be explored. But let's look at by 2006 studies, and I'm sure you, Dr. Walcott and others will, talk a little bit more about that. But by 2006, there, John Hopkins and other institutions started looking and showed some significant results that really woke up the world. But again, there was substances that was banned considered, but had significant clinical implication, especially in psychiatry. And the clinical significant response led John Hopkins to have published this report that 75% of patients experienced a clinical significant response for at least 4 weeks. Another 54% really had remission of depression, and that was a very significant in moving forward. With a relook at the laws or the condition relating to medical treatment. It is important to note in that background that happens there, that important breakthrough came in 2019 when US Food and Drug Administration granted breakthrough status to compass pathway to this for the study of psilocybin in conjunction with psychotherapy for the treatment of resistant depression. And that means that FDA recognized that the research demonstrated that the drug may have substantial improvement and at least one clinically significant endpoint. And that again was very important. So I wanted to just mention a few other points here. Just in passing, that another important spin-off that the psychedelic had important treatment portfolio is that of ketamine, and which was the first of its kind that had FDA approval, and many studies have demonstrated the treatment in refractory depression. But where do we stand legally in final wrap-up? Is to say that although the psilocybin is considered by as a controlled substance, is Schedule 1, ratified by UN, not all countries had actually ratified that convention. And in at least 5 countries, and Jamaica is one of those, that did not sign that treatment or that conventional manuscript to say that it was illegal here in Jamaica. Other countries like Brazil and Portugal did not sign forward that. In terms of its regulation in Jamaica, if psilocybin is used, and here there is no law that prevents any individual for formulation or management within. However, since the Ministry of Health in Jamaica signed up with the International Narcotic Commission, there is that kind of disparity in which should a company want to do science or study of psilocybin here in Jamaica, would they be allowed to practice freely? And this is where the framework of a group like ours now will ensure that we look at certain safety guidelines, certain other aspects of legalization, or providing the science by which regulation can help us to safeguard the proper treatment, science, and regulation safely in Jamaica. And also, in so doing, help others in the Caribbean to have this kind of a format in moving the study and treatment going forward. And right, good.
Good. Okay. Thank you. Thank you for this brief introduction. So Dr. Gordon was mentioning psilocybin and also ketamine as possible alternatives within psychedelic treatment. So I'd like to move over now to Dr. Bhatt, who will explain a little bit about the other possible compounds that are being presented within mental health treatment, which are the group of what were traditionally called as classic psychedelics, which include psilocybin, as Dr. Gordon mentioned, LSD, DMT, which is the active ingredient in what some may know as traditional medicine from the Amazon, that's called ayahuasca, and also MDMA, which is not really part of the classic psychedelic family, but is the controlled substance that's gaining a lot of traction right now for the treatment of PTSD. So Dr. Bhatt, take it away, if you will.
Yeah, absolutely. That was a great introduction to psilocybin. I took the words right out of my mouth. I was going to say the same. So as Natan mentioned to you all, there are other classical psychedelics that are gaining much more awareness in their potential as a therapeutic in treating mental illness and several other neuropathologies. One of which is LSD, or lysergic diethylamide, and that was synthesized in the lab, we all know, by the great Albert Hofmann at Sandoz Pharmaceutical. And it also functions via the serotonin pathway, as psilocybin does. And by doing so, it mimics the molecule and has been shown to show great efficacy in treating treatment-resistant depressions, addictions, and actually that's how it got its notoriety, was in the treatment of alcoholism in the 50s. We also see MDMA, 3,4-methyl diethylene dioxymethamphetamine. Sorry about that. It's a synthesized molecule that was also created in a lab and has shown great efficacy in treating PTSD and furthermore addiction. And it's a bit of a dirty drug in the sense that it hits not only serotonin receptors, but also adrenergic receptors and noradrenergic receptors. So it's kind of able to do a whole lot more. And so we see that a drug like MDMA is able to induce great empathy in its takers, and thus lowers the threshold and allows, with psychotherapy, a greater potential for remediation in mental health. And then lastly, we have DMT, which is, I would say, gaining probably the most interesting notoriety right now, as it is endogenously expressed in our body. We see it in heightened levels at birth and near death. And it is a very powerful psychedelic. And it, in traditional senses, it is brewed into a tea known as ayahuasca, which is the combination of a shrub and the ayahuasca vine. The actual DMT molecule is found in the shrub, and the ayahuasca vine actually acts as an inhibitor to prevent the breakdown of DMT, which occurs very rapidly in our brain. So we want to try and hold on for it as long as possible. The difference between a brewed version and an inhaled version is basically the onset and the duration. In an inhaled form, you do not have the monoamine oxidase inhibitors. So you typically get a very intense, powerful experience, transcendental, as many would say. And not to say that you don't get that in the brewed version, but it is a much, much shorter duration on the scale of 15 minutes compared to several hours, followed by the gastrointestinal issues. Each of these molecules have, with the advent of the psychedelic renaissance, they have been allowed to be focused more in research as we work to understand the consciousness of the human mind and how we move through things and develop resistances. And they have really opened up doorways and portals into basically what is us.
Good, amazing. I would jump down to the clinical applications, what the research is saying, how these drugs can be are being presented as very viable alternatives to what is currently used in psychiatric treatment for several disorders. So maybe Dr. Walcott, you want to start telling us a little bit about the research, and then Dr. Bhatt and Dr. Gordon, feel free to interrupt or just raise your hand if you want to say something. We'll
All right.
work it like that.
Thank you very much, Nathan. I mean, that was a wonderful presentation, and I know Dr. Bhatt is very knowledgeable and passionate about the pharmacodynamics of the psychedelics. And truth be told, in terms of clinical practice, probably in our culture, we're not as exposed to, even in terms of recreational use, psychedelics per se, marijuana being one of the main drugs that we see utilized in this country. However, one of the things that has become more apparent, especially in clinical practice, is that we really have to find best or better treatment options for our patients. And when you're looking at introducing any new drug, the question you have to ask is there a reason? Is there a need for it? Does it add any value? And we know in particular areas, especially depression, and you mentioned PTSD, conventional therapies are woefully lacking in terms of enhancing productivity and allowing our patients to return to their normal way of life. And we do see, especially there have been criticisms about the restriction in emotional regulation and emotional enjoyment in patients, even while on medication. So there is a need for alternatives, and we are well aware of that. Studies that have come out have shown that these particular agents have shown promise in specific disorders of anxiety, depression, and particular substance of abuse issues, such as alcohol and tobacco specifically, and that they actually can provide some level of benefit in our patients having a holistic experience in terms of their well-being and their health. And so that's critical. But suffice it to say, it's not just limited to persons who suffer from clinical problems or have diagnosable issues. We do recognize, especially for particular psilocybin, where studies have shown that there is an impact on how we perceive negative affect stimulus or negative thinking. So the root cause of anxiety is that we are bombarded by what we call negative affect. And it has been shown in some studies that there's a reduction in the response to negative affect, and there's an enhancement in the response to positive affect. You have other substances like the MDMA, which enhances empathy and emotional connection to others, which we have always recognized as a therapeutic motif in dealing with not just specific disorders, but the human condition on a whole. We survive by being able to connect with each other. We survive in a communal fashion. And so enhancing that connection through empathetic strengthening and emotional bonding enhances not just the individual, but the society or the community. And certainly we've used some of these agents in group work with specific targeted group to enhance productivity, enhance creativity. So there's a wealth of opportunity that exists. However, with everything, we also have to be mindful that they do have drawbacks. And one of the things that we have been cautious of is that, as you know, that this particular exploration has been taken in the form of a very scientific rollout. There are lots of studies that have been done. So it's not what would normally be referred to as non-conventional or non-streamlined pharmaceutical. We have to do thorough investigations because they all have drawbacks. And certainly we recognize that there are some patients or some persons who may experience negative effects from the drug. And so we have to be clear, as with all interventions, what the benefits and what the risks are for us to engage in. So I think this is why we are here, because this is an avenue for expansion, and it gives us the opportunity to provide for not just our patients, but our entire community, a way of addressing issues and problems and enhancing their own sense of productivity and creativity that we never had before, that was being restricted by misunderstandings and political complications with legal systems. So that's my 2 cents.
Perfect. And would you like to go into more detail on specific clinical studies that have been done and what is the clinical evidence showing for the benefits of these compounds?
I mean, Doc mentioned the 2006 study, but there have been a few in last year and this year that have come out that have actually looked at the neurological, neuroanatomical impact of these substances on brain structure and function. There's a particular study that I highlighted with regards to the affect. And what it looks at is the impact on plasticity. Now, 20 years ago, we thought that the brain itself was stagnant. You're born with brain cells and they basically shrink until you die. But that's not true. Your brain restructures and reformats on a continual basis. And what that says is that as you are learning more information, as you are developing more, you actually create new pathways, and you lose pathways that become redundant so that your brain maintains a level of efficiency. And what has been shown in particular areas of the brain, like the amygdala, areas that deal with anxiety, areas that deal with drive, and the limbic structures with emotional regulation, what has been shown is that you get enhanced activity within these particular areas, where you have areas in the side of the brain that has to do with pleasure, not pleasure center, but actually the concept of the idea of dealing with pleasure in the prefrontal cortex, that you actually get enhancement in those areas. So you do have studies that have been come out that shows that these things can be beneficial, and they are particularly targeted to enhancing well-being, which is what they were being used for in the traditional sense.
Great. Okay, thank you for that, Dr. Walcott. Dr. Bhatt, would you like to tell us from a pharmacological perspective what is the mechanism of action? Dr. Gordon did touch on that on some degree, but maybe you can expand on how these drugs work in the body and the effect they produce.
Absolutely. So as Dr. Gordon mentioned, a lot of these psychedelics, and particularly psilocybin or psilocin, the active molecule, psilocybin is actually in fact the prodrug. They operate by the fact that they mimic the chemical structure of serotonin, which is an endogenous neurotransmitter that governs a number of behaviors in our body. The way that these particular psychedelics operate is through the serotonin 2A receptor subtype. And we see that the distribution of those receptors occurs profoundly in the cortex of the brain, and with particular emphasis in the high functioning areas, what are called the high functioning areas. You can establish and separate the functionality of the brain into primary and secondary processes. And we see that the greater density of our serotonin 2A receptors are found in the secondary processes that lead to higher order cognitive thinking, which separate from the primary, which is more of your reactionary. Hope that answers. I can go much deeper, but.
No. I think let's leave it at that for now. And I think at this point, it's important to understand if these drugs present so much potential for healing purposes, why are they controlled? Why are they illegal in most countries and most jurisdictions around the world? And what is the brief history of how these drugs became prohibited and now are coming into legality again, slowly but steadily? Dr. Bhatt, would you like to introduce that? And I think Dr. Gordon will be able to give us a hand with this as well.
Absolutely. So there's no really easy way to put it. A lot of the hindrances have been as a result of bureaucracy. The initial studies that gained the movement in psychedelic research occurred probably in like the start in the 30s. The most profound research came in the 50s and 60s with two separate groups. One group including Humphrey Osmond, and the other group was, I blank on his first name, but it's Dr. Sanderson. And they are both, so Dr. Sanderson is UK based, whereas Humphrey Osmond was US based. And they were looking at the implications of using LSD on patients in treating various types of pervasive mental illnesses. Dr. Osmond was looking, and his group was looking at treating alcoholism, whereas Sanderson was looking at, in addition to alcoholism, other types of neuropathologies in mental health. The studies that were concluded from the Saskatchewan trials that Dr. Osmond concluded resulted that a single bolus of, or single dose of LSD was sufficient enough to either completely abolish or with further psychotherapy, you could eventually reduce or remove the addiction to drinking. Whereas Sanderson used smaller doses of LSD with psychoanalysis in concurrence. And they also identified that this was a very, very effective way to use psychedelics as an adjuvant to psychotherapy. After which there was a growing concern in which the US FDA started regulating and controlling LSD as it was an experimental drug. At the time of its synthesis, Sandoz didn't really know what to do with LSD, so they were literally giving it away to people. And it eventually hit the streets, and it became a more of a culture drug, which tended to turn off some of the politicians, and it led to its eventual scheduling and the creation of the Drug Enforcement Agency Scheduling Act. And it got lumped into a Schedule I drug, which states that there is no medical or therapeutic benefit to any of the compounds found in there. You can find things like cannabis, MDMA, heroin in that group. And so that led to a little bit of a halt in psychedelic research as the momentum kind of shifted away until the 90s kind of brought around a resurgence, and we see more of the pharmacological and neurobiological studies being performed as we attempted to better understand what psychedelics were. And this is really where you see the introduction of psilocybin, in addition to LSD and MDMA and some subsequent studies following ketamine. Dr. Gordon, would you like to talk a little bit more about the international ramifications of all this? Because it's huge.
Yes, I mean, of course, that was brilliantly said. And of course, you must understand how it all began with all of this was in between the 1960 to 1970 in the Controlled Substances Act that was propounded by the United States of America, in which they had thought, and of course, knowing the history, which all of that all grouped together, the hippie movement, everything, and persons, as you had mentioned correctly, the leaking out of the extract psilocybin on the street, and people were then using indiscriminately. So although the science was being happening there, politically, it was all grouped together and put as Schedule 1, brought to UN, and that curtailed the actual research or expansion of it. So again, no benefit, no significant medical benefit, and harmful to human. Those were the conditions that was propounded. Interestingly enough, some of the earlier studies at Harvard had shown even healthy volunteers had gotten some quite important feeling, which was then considered to be the psychedelic, even for healthy volunteers. And the first set of studies that were done had some awareness. Their thought wave, their mannerism had actually changed. Other studies really significantly showed that persons who had depression, as you rightly and Dr. Walcott put forward those notions, had gotten quite a bit of benefit. And some of the research centers in the world, in Israel now, they're using combined cannabis and the whole psychedelics. Are they important in even cancer or other mental conditions? So it's such a wide opening of information that is happening today in the world that we scientists now, guided by, of course, public opinion, because if you're not a scientist or you're not a doctor, your opinion is very important, because that changes political policy so that we can scientifically research and provide good medicine for persons. Can you imagine that, over in many places, quite a bit of persons, up to 70% of persons in some populational studies have some degree of mental illnesses. And of course, with what is happening today with the pandemic, we know that it's going to increase. So can we then provide medicine for depression, which of course, we have not underlined some of the benefits when you look at addiction profile. The psychedelic psilocybin is at the lower end of the addiction. In terms of overdose, it's at the lower end of the spectrum for overdose. in terms of tolerability, also that is important when it compared with other substances of use. And in fact, psychiatrists would also show that when you're, for addiction purposes, with the introduction of, proper trained dosage, you can actually slowly wean patient of these other illicit drugs that may be more harmful. So they are such wide, important application medically that we can use these benefits of the psilocybin in really changing the outcome of these mental illnesses, withdrawal from all forms of addiction, maybe alcohol, maybe other substances, and the actual benefits. So there's a conversation that we all must get involved in. And as I said, those who are not doctors out there, their opinion, as we have seen in Colorado, it is the public opinion that has gone politically to their congressmen and have said, listen, this is something that we need to act on, and in so doing move the conversation forward. And if you even look at what is happening in Florida today, there is a movement to allow the legal use medically for psilocybin. And this is happening throughout many other jurisdictions. And this is the kind of opinion and education that we can provide in a forum like this. Let us have the conversation. Let us speak about it. Let us provide real medicine for persons who are suffering out there silently.
I just wanted to continue on with that. The changing in public perception is the biggest thing that you touch on there. That's what's shown great advancement in the acceptance of psychedelics and the reason we see the changing in legislation. The previous notions of how psychedelics work and the negative stigma that was associated with them in inducing psychoses really prevented the progress of all this. And through the education and understanding what are the adverse effects, how are the pro effects of these molecules, and having that kind of intimate knowledge in the average individual has really progressed our ability to make progress in legislation and research as a whole. So I just wanted to say that is absolutely the public understanding and doing their own research and identifying what are the pros and cons of each of these molecules. And we'll touch, I see a lot of individuals are asking about adverse effects. We will absolutely touch on that. It is changing public perception is the one way that we are gaining traction.
Yeah.
If I may.
No, go ahead.
Yeah, because I think part of the difficulty also with regards to the issue of the relationship between psychosis and psychedelics is probably entrenching a lot of stigma. Cannabis has the same correlation.
Just a little introduction, since we're going to go into this. This is part of the questions that are being asked on what are the possible adverse effects. So just to introduce that topic and go on, Dr. Walcott.
Yes, but it comes from a time, if you recall, when psychosis had a very different view that it has now. And certainly we recognize patients who are at risk, who are predisposed to either mood disorders or psychiatric conditions such as schizophrenia or psychosis. We would prefer that if the medication are going to be used, psychedelics are going to be used, they have to be used in a controlled setting with a qualified psychiatrist to manage the difficulties. And that's a standard. No drug is without its limitations and no drugs are without its shortcomings. But we are also in an era where psychotics are being properly managed and are able to live healthy, productive lives. And the actual management is not as it was before, where it was almost a doomsday diagnosis. So we have to be mindful of the time that we're living in. We do recognize the risks, but there are sufficient avenues to address and mitigate those risks, both in terms of screening and in terms of treatment. So that's one thing I wanted to say.
Good. So let's dive in.
I would like to just make one comment. Two aspects of the comment is that we have to respect all form of drug. And drug must be designed for particular treatment. And maybe for the side effect, maybe we can, and I'm sure some of us who understand what's happening should make a statement. Because if persons who abuse a drug, and it doesn't matter what the drug is, even aspirin, overdose of aspirin can cause death. And in the setting of a substance that can change mood or has changes in the brain, it must be handled in a simple way with care. And so the aspect of the application and the treatment is such a good model. That means if one thing, if you are taking psilocybin, for example, for the wrong purpose, you will have a bad trip. Let us just say, use this terminology, bad trip. If the environment in which you want to be treated for a particular mental condition, you do not have the dosage or have a regime for the application, it could hurt you. And this is where you get all of those significant side effects. As it is said and supported by many of the researchers, the environment or the setting is very important. The person to guide you through that treatment profile is very important. If you're taking chemo drug, you can't take it at home. You should not administer chemo drug at home. If you're taking psilocybin in a respectful way, you must be guided by a person who has experience. You must follow some degree of format, whether it be dosification, whether it's called minimum or maximum dose, which we then term microdosing. And so they are formulation. And if you take it not for the intended purposes, this is where significant side effects are experienced. So this is one of the things I would say overall that could answer that aspect of side effects. Importantly noted, person who can guide you, and they don't necessarily mean a physician, but in conjunction with a physician, psychiatrist, and a trainer with the right environment, which is the right setting, your journey, which is called a good trip, may be ensured, or better, you're better able to tolerate the treatment. If you design your treatment, which is not uncontrolled at all, not controlled treatment, then the bad trip are those experience of psychosis and your perception of time and all of these are the things which, of course, some of the side effects that outlined, palpitation, but I mean heart racing, the blood pressure could go up, you could go into a prolonged state of psychosis. So all of these need to be addressed, and this is why we have this conversation. And if you decide there to take this drug, then consult with somebody who knows how to treat you and what are the characteristics that the drug may enhance.
And would you say that there are specific patient profiles that should not take psychedelic drugs at all? What are the particular?
Yes, and I'm sure I can ask Dr. Walcott, because he and I have discussed this. Dr. Walcott, you want to weigh in on this?
Yeah, man. So I think particularly those persons that either have active psychotic symptoms or who are diagnosed with schizophrenia or who have a mood disorder, bipolar disorder, it should be used with caution. There's a paradox to that, because persons who are having suicidal ideations or who have suicidal thoughts may actually benefit, but that administration has to be done in a very controlled clinical setting. I know there is particular ketamine has been explored in terms of reducing suicide risk, and I know that the pharmaceutical companies have actually gotten through and gotten FDA approval for a form of ketamine in severe management of depression. specifically targeting suicidality. And so there are benefits, but those particular conditions should be screened, and they should not be administered unless under very specific guidelines and under expert psychiatric care.
Perfect. Would any of you, I presume Dr. Walcott or Dr. Bhatt, but whoever wants to take this question, would you like to address or describe briefly the new paradigm for psychedelics-assisted psychotherapy, which, from my understanding, is different from traditional psychiatric or pharmacological treatment, and it's also different from what is called talk therapy or normal psychology. So it's a mix.
I'll
between
just jump in a little bit before
like
Dr. Bhatt.
Yeah.
I think Dr. Bhatt has a better handle on this one. But there, I shared two references, and I think the second one speaks to that, because it actually shows the enhancement in feelings of mindfulness. Now, mindfulness is a very critical buzzword in the psychotherapeutic community, because it is thought to be one of the core therapeutic modalities for dealing with things like anxiety and depression. And so you do get enhanced mindfulness. So I'll allow Dr. Bhatt to speak a little bit more about that.
Yeah, so there are two main modalities that have kind of arisen, and we are now experimenting with newer approaches, which involve going on retreat or in providing a very positive set an environment for the patients to truly expand on their observations and be in a comfortable mind. The two approaches in traditional therapy are the psychedelic therapy, where, as Dr. Osman had identified, taking a single dose and followed by psychoanalysis. It's shown very efficacious in treating some of these symptomologies. And the other one is a psycholytic therapy, which is what Dr. Sanderson produced in administering several smaller doses over a period of time concurrently with psychoanalysis. These are, again, the older approaches to psychedelic therapy, or introducing psychedelics into the assisted therapy. What we are playing with now, with the advent of psychedelic retreats, we see that improving a greater connection to the environment and nature has a much more profound effect in remediation of some of these pathologies. So things are evolving, but one of the newest methods is providing both a macro or a microdose, and to clarify on those two terminologies, a macrodose is what is commonly known as a psychedelic dose. It is a large dose of the psychedelic that produces vivid hallucinations, synesthesias, and which is basically a crosstalk between different cortexes in the brain, like the visual and the auditory, to produce like I see sound, those kinds of sensations. And the microdose is a suboptimal dose of the compound, which is enough to agonize the receptors. This is the serotonin 2A receptor, but not so much to really put on a full-on psychedelic experience. Depending on the method of approach and what the individual is trying to achieve, and the individual is your therapist, you will receive one of either. And so usually there is a dose administered. Sensory deprivation usually follows in psycho-assisted therapies, where a patient will lay down with headphones and a blindfold and a blanket and get a very comfortable set. Prior to this actual event taking place, there's a rapport that is built up between the therapist and the patient, so that way there's trust, which is a very important part of using psychedelics. And when undergoing the treatment protocol, sensory deprivation will persist, and you basically, the internal workings of the psychedelic comes through, and an individual, through the sensory deprivation, is able to come to profound understanding and a visual experience that later their therapist can actually help them translate and produce more effective measures. So it's an ever-developing field of how we administer the drugs. Some are retreats, some are the traditional psychedelic therapies or psycholytic therapy methods. It's ever developed.
Good.
I just want to respond to some of the questions from the audience. What age limit? What is the age limit to begin? The psychedelic? So far, in many regulations, they have not, and the science has not, as far as I know, really put any age limit. It can be based upon the treatment and the illness, and of course, not to be administered to children at this stage, but safely, we would say, following somewhat a guideline would be that of cannabis, we think over 18 or thereabout. Um, what are some of the, um, you know, approval that have been given? For example, Canadian approval by the Canadian government last year has given approval for end of life treatment, which is very important. So that has been an indication in Canada that there are enough evidence. And of course, the evidence is pushed by public opinion, by groups that have shown with science. So it's a science and public opinion with the various groups has pushed for that. And that's very significant. In our setting, one other question here in Jamaica, when some of the clinical trials will begin here in Jamaica. The clinical trial protocols are with the University of the West Indies, being studied for approval by the ethics. Others are with the Ministry of Health, the approval committee that is, we are hoping that in the next weeks or so, some indication that in our own Jamaican setting, some clinical trials, these clinical trials are mainly about depression. I'm going to go into the detail of them, but it's about depression, which two of which are synthetic, psilocybin, and one is that of a natural occurring extract that is being used for setting up depression. So that's what is happening. And one presentation I had to the Jamaica Medical Doctors Association on the island, I have gotten very positive responses from the doctors throughout the island who very interested in want to participate. So this is a good audience, it's a good beginning. And for Jamaica, and I'm not advertising by any means any group, because we work with all and facilitate the industry, but a lab which was announced in collaboration with the University of the West Indies in looking at providing some means by extraction and possible means by which we can validate substances, characterization, chemical analysis of compounds that may be used in a controlled way as a drug that could be approved, was set up recently at the University of the West Indies. And that could be a framework by which all partners get together in providing an industry that is very stable and we can trust.
Amazing. I think everyone would like to know a little bit more about how these compounds can be used in a non-clinical population. There's a lot of talk about microdosing. Psychedelics can be used to enhance wellness, productivity, concentration, creativity. So how are these compounds being studied and used right now in a non-clinical population? Maybe Dr. Bhatt, would you like to introduce this topic?
Yeah, absolutely. I was actually typing out that response. So a lot of the studies that are looking into the dosing profiles of psychedelics are still they're still ongoing. And so we're still learning more about the actual potential and benefits of microdosing, as this is, while it's been around for the past decade in silicon types, and we've heard those stories, that it is a productivity hack, as one individual in the Q&A has labeled. And most of these results have been purely anecdotal. The research, like I said, is still ongoing, and the problem is the limitations of research in of itself. Unfortunately, in a clinical setting, you may not be able to get a sample size or a power level high enough to be able to establish significance. So there are researchers like Dr. Robin Carhart Harris at Imperial College that have created a psychedelic survey for those that choose to embark on their own personal, to help record and provide evidence for the benefits and their experiences in either the micro or macrodosing. And there are several areas of research that his team is looking at, and they're trying to crowdsource this. So assistance from you all is highly encouraged. But yeah, so microdosing is the idea that you take small amounts of the psychedelic, and you are basically taking enough not to induce a psychedelic state or a mind-altering state of consciousness, but is enough to reduce the threshold of your brain to allow for communication of the different nuclei or the different cortexes of the brain. So that way those networks can communicate with one another in a way that is otherwise not possible. This has led to the theory of the entropic brain, which basically states that, you know, our brain, as in the state of entropy, likes to operate at a low level entropy, so something of more order. However, as a consequence of this low ordered state, we see that this is where you wind up with some of the mental pathologies that we are discussing today. So by providing microdose schedules and regimens, this is highly encouraged to do with a therapist, so that way you have somebody to talk you through this and properly record and analyze some of these experiences that you're having. While microdosing does not impart a mind-altering state, it does open up the possibility for greater thought and creativity as a consequence of opening up those processes. There are several studies that have shown that there is a neurogenic property to taking these psychedelics, as Dr. Walcott had mentioned. Our brains are not static. We're very plastic, we're ever growing. And this came out in the advent of identifying that the hippocampus of our brain actually takes an active role in creating new neurons. And as it would so happen, introduction of psychedelics stimulates the hippocampus and the parahippocampus to increase neurogenesis. And so what this means is that not only are you creating new cells, but you're increasing the arborization of those neurons. So those processes are able to connect to different regions of the brain and thus open up the mind to potentials that we otherwise were not able to access. There are maps that have hit the mainstream that show exactly the therapeutic potential in increasing the neurogenesis and the neuroplasticity of the brain following a psychedelic dose. And that just goes to show you more so how these molecules actually can help reverse some of these long-staying mental illnesses. So whether it's microdose or macrodose, there's just profound evidence to show that it's very efficacious in these treatments.
Great. Thank you so much for that, Dr. Bhatt. Okay, so we have two questions that haven't been addressed. If anyone in the audience has any question that would like to introduce to the panelists, this would be the right time to do it. So I'd move over to the two questions that were left unanswered. First, is there any adverse effect of using psychedelics assisted psychotherapy in combination with antidepressants? I did read a recent study that MDMA assisted psychotherapy could be less effective in combination with a patient population who is using antidepressants. So is there anything you can mention about this? Maybe Dr. Walcott, if you'd like to weigh in, or Dr. Gordon, Dr. Bhatt, whoever feels more comfortable with this.
I'll make a quick stab at this. So the use of antidepressants, antidepressants work by preventing the reuptake of neurotransmitters to the postsynaptic side of the neuron. So by preventing this that's presynaptic side, we want to keep around the neurotransmitters in the synaptic cleft so that way they bind more. But by preventing the reuptake of the neurotransmitters into the pre-cell side, we are allowing the binding of serotonin or dopamine or the adrenergics, depending on the type of antidepressant or antipsychotic that you're being administered, to bind the receptors that will enact the secondary messenger or the downstream effects that we desire for normal neurological function. There are, depending on the psychedelic that is used, and you mentioned MDMA, which is a very, very good example of this because, as I mentioned earlier, it doesn't just touch serotonin receptors, it also touches noradrenergics, which we see to be more pervasive in other types of mental illnesses. And so, yeah, there can be contraindications to taking psychedelics in conjunction with an SSRI or an SNRI due to the fact that it's going to prevent and possibly overload or disrupt the normal function of those psychedelics as they work through the mind. I'm sure Dr. Walcott and Dr. Gordon have more to expand on that, but it's just the job of the antidepressant is to do what.
Yeah, and I think we always have to be cautious because there are some life-threatening conditions that can happen from uncontrolled elevated levels of serotonin, like serotonin syndrome. So it's something that we would use with caution, and as I said, in controlled environments. There are no clear contraindications of using both, but it has to be done in a way that the patient can be monitored, and if they do develop a drug reaction, that it can be addressed.
Perfect. Okay, thank you for that. So lastly, last question that we have not addressed. Someone in the audience was inquiring about cannabis's effect in reducing seizures that has been shown to have great potential in recent years, and if there is any application of psychedelics in that respect. Dr. Walcott, do you have anything to say about this?
I haven't seen any studies, and as I said, seizures are not my area of expertise, really.
So with some of them, like ketamine is a great example of it's not a psychedelic, it's a dissociative, but it has psychedelic potential. It has been shown to be efficacious in treating some of the seizures due to its other agonism of glutamate receptors, and so it doesn't touch just serotonin. And so that potential is able to reduce the occurrences of seizures, but you do need to take repeated sessions in order to get that efficacy. Cannabis is special in that the different cannabinoids that are in there, and also the fact that you have a non-traditional cannabinoid in cannabidiol. So this is a compound that is not binding cannabinoid receptors with high affinity. Cannabidiol actually binds serotonin receptors, adrenergic receptors, and different types of receptors, including mu opioids, to kind of reduce the nerve firing potential in the CNS. And so that is why it has become a very efficacious molecule in treating seizures. Now, in combination with psychedelics, you can help alleviate some of the anxiety and some of the comorbidities and mental illness that comes from having chronic seizures. So in the terms of your classical serotonin-based, your tryptamines, you typically do not see, and as Dr. Walcott said, there's really not a lot of evidence in the literature for this. This is purely theorized, I can say. You may not see a high degree of potential for it to assist in seizures or seizure remediation if it is a tryptamine, in the sense that while serotonin does play a role in seizures, it is not the predominant neurotransmitter that is operating here. So you need to do other things in order to effectively quiet the nervous system, so that way you do not induce these effects. So in combination with other types of drugs and anti-seizure medication or cannabis, you can see a greater efficacy in the treatment of seizures. However, without more research being performed, we are still very much in the dark. We have seen some positive results with ketamine and potentially MDMA. However, MDMA is not typically used in this regard due to its euphoric and empathic properties. That's not the goal that you're going for. And people typically don't microdose that. So perhaps microdosing MDMA would be effective in kind of calming the nervous system, as it is doing that. But there's just not enough evidence out there.
Good. And how about the combination of psychedelics and cannabis for someone else from the audience, for a chronic marijuana user, is there any risk of using psychedelics? I assume that it's hard enough to research one controlled substance than to actually do research in two. I think there haven't been any studies on that, but maybe anecdotal evidence or from a theoretical perspective, you have some input.
So there's actually been some pretty cool stuff done with cannabinoids preventing cannabis use. And that's cannabidiol, again, is back for the show. Even though this is not a cannabis talk, CBD actually has been shown to increase the ability of cessation in chronic cannabis usage. Psychedelics can also offer this due to its impart in the prefrontal cortex and many of your other higher cognitive regions of the brain. So there is, I would think that there is potential for it, as we have seen it to work in other types of forms of addiction, in alcoholism and heroin usage and whatnot. And we see a greater usage of ibogaine. Ibogaine has been really, really positive in the treatment of heroin addiction. So there's no reason why we can't believe that this would be a possibility. But again, without the clinical research, it's really a stab in the dark, to use a very poor sentence, but it is one that there is high potential for this because we are talking about serotonin. The combination of psychedelics and cannabis usage can also be very effective when we come to talking about treating cancer patients and those that are end of life. The reason being the calming effects of psychedelics in the ability to rationalize and come to terms with some of the emotions and mental states that follow end of life care. They've been very profound, and between Paul Stamets, Dr. Carhart Harris, Michael Pollan, we've seen a lot of evidence in people really finding relief in those late stages with the aid of psychedelics and cannabis. And the fact that cannabis works in cancer to increase appetite and also its anti-tumorigenic properties. I find it hard to believe not.
I just want to state that in a recent literature search, the Israeli group, and I have those journals available, has shown the combination of psilocybin and CBD in treating for cancer patients. And this is mainly end stage. And the idea was to combine a targeted reduction in terms of the proliferation of the cancer cell.
Okay, I think Dr. Gordon, you got disconnected there. Let's wait for him if he comes back. Okay. Well, in any case, we were nearing the end. This was a very informative conversation. I'm sure everyone who participated and even from the audience got a lot out of this.
Yes.
So, okay, Dr. Gordon is back.
Yes, sorry about that. So when that is combined in such a way, they are getting very good relief of control and treatment. So that's something new, and that's something that there's much more research and science that is needed in going forward. But of course, this is depression and acceptance. So this is where our scientists are conditioned to go forward with these research.
Good. So some connectivity issues, I guess. Okay, so is there anything else that any of the other panelists, Dr. Walcott or Dr. Bhatt, felt like need to be said? I think we covered pretty much everything for everyone to get a good basic understanding of psychedelics, what they do and their treatment. So sorry, Dr. Gordon, we're sort of wrapping up here. So I was asking if there was anything else that anyone felt that should be said, but if not, I think we're gonna go home. So you're probably already home.
Yeah. I did have one last plug, and that's again the psychedelic survey. If those of you are
My side
interested in doing this,
for the next minute thing, we are expected, and as advocate, can you hear me, please? All right. So just quickly, in my last minute, I would say, as scientists, researchers, and as advocates, you know, all three categories of persons, we believe in the science by which we can provide the healing of the world and providing some positive treatment as depression and all other mental conditions are concerned. Then those of us who are scientists, let us practice the science, and persons who are regulators, let us provide the guide by which science can provide a pathway for treatment. And as advocates, let us continue the dialogue with our political representatives. Let us continue educating the population that all of the respected partners in providing the pathway for the best treatment modality, and let us all work together as believers in something that we are working with or working for in treating people with different mental health conditions. And that's my closing.
Thank you, Dr. Gordon.
Let the science guide us in going.
That was very inspiring. Dr. Bhatt, you were saying something as well.
Oh, I was just shameless plug for psychedelic survey. Those of you
No,
that
go
are
ahead.
interested in performing your own microdosing experiments, there's been a lot of interest in getting into studies. Definitely try. Those of you that are eligible, please try to administer. We do need patients. We need the data essentially to better understand exactly what these molecules are doing as they work to treat mental health. But there's also crowdsourcing options. And I would like to remind the psychedelic survey again, psychedelicsurvey.com. There are several studies, and they go from ritualistic approaches to end of life, microdosing, and macrodosing in a recreational sense. So the surveys are there, and unfortunately, until we have greater interest into the advancement of clinical research and a greater acceptance of psychedelics as a whole, these are options that are out and available for individuals. Check out news sources like the Psychedelic Review, or keep your notifications up on Psychedelic Science. There's so much coming out daily. The new labs that are opening up around the world, including the one that just opened up on the mainland, has been really profound in getting us started. And we are seeing much like, and the difference that we see in psychedelics versus cannabis is that there has already been so much positive evidence in the rich culture of psychedelics that we are now able to capitalize on it, which cannabis unfortunately did not have. So Godspeed to you all.
Good. Thank you for that. Okay, thanks everyone for participating. This has been very illuminating, and please check the rest of CanEx's webinar series. It's gonna have a lot of great content and a lot of great stuff in the future. So I thank you very much, and have a good afternoon. Enjoy your day.